Hey, I'm Dr. Mori, and today I am presenting my research as part of the 2024 International Congress for Qualitative Research and Methodologies. So, the study is Resilience during the COVID-19 pandemic, Experiences of Single Working Mothers, published in 2023. Today, in this presentation, you will understand why I decided to research this topic of the experiences of resilience of single working mothers during the COVID-19 pandemic. You will see how I proceeded and what I found. You will hear about the problem and the research question that came out of it. You will hear about the significance of this research and about what I found in the literature. Then you'll discover the methodology I chose to use and see why it was essential to my research. Next, I explain in details the findings of the research and accept implications. I finally discuss the limitations of the study and my recommendations for future research. I'm going to briefly talk about the literature. So, a few studies investigated the experiences of the resilience of mothers during the COVID-19 pandemic, and fewer of the resilience of single working mothers during this crisis. This gap in the literature is concerning, as according to the US Census Bureau, the percentage of single mother families in the US family makeup has been slowly and constantly increasing from 10% in 1965 to 19% in 2022. Seeing this gap in the literature, I concentrated my research on first working mothers and then single mothers, mental health, and resilience, all in the context of the pandemic. So the pandemic put forward working mothers' fourth shifts: work, the care economy, the emotional labor, and distance learning. These accrued responsibilities often led to exhaustion, the first sign of parental burnout. A new term that I learned is parenting role overload, which is when these roles overwhelm by using too much time and energy. A study by Coggers et al. In 2021 found that women suffered more than men from parenting role overload during the pandemic, and that it concerned mainly those who were taking care of their children's schoolwork. So the pandemic reopened the debate on gender gap as it appeared in parenting roles and unemployment. Resilience during the pandemic emerged in the little things: being self aware, creating new routines, finding creative ways to maintain normalcy, accepting what was, persevering, finding positives in their experiences, practicing mindfulness. So, the methodology. For design, I chose to conduct a qualitative research with narrative inquiry and the listening guide analytic method. The narrative inquiry methodology helped me listen to and understand my participants' stories of resilience during the COVID-19 pandemic. Clendenin in 2016 explained that narrative inquirers are relational inquirers, subjective part of the inquiry. I intentionally chose to study single working mothers' experiences because of my experience as a single working mother. It made me wonder about others' experiences during of the pandemic. The listening guide is an analytic method of listening to participant psyches using psychoanalytic and feminist perspectives, which enables researchers to go beyond participants' words and listen to their unconscious to unveil their complex voices. The so for the recruitment, I recruited on Facebook and LinkedIn 9 single working mothers who self-identified as resilient. For the inclusion criteria, it was all based as of March 11, 2020. The participants had to be non-pregnant, single mothers aged 18 to 65, fluent in the English language, with at least one child under 18, living in a solo home, working full time, and in case of divorce, they had to have 50% or more custody of their children. For the data collection, so I conducted 1 hour in-depth open-ended interview on Zoom. It was video recorded and transcribed verbatim. Okay. I also asked basic demographic questions. I conducted mindful breathing and field notes. I'll tell you more about that. So I started our Zoom meeting by asking basic demographic information timed as of March 11, 2020. And I asked about their ages, the ages of their children, about their work, ethnicity and race, about their custody situation, if any. I also asked if anything had changed since that time. Next, I invited each participant to take 3 mindful breaths with me to increase presence and foster relaxation. Then I started the interview by asking, how did you experience resilience during the COVID-19 pandemic? And then I also wrote field notes, few during the interview, but most of them right after and days later. These notes transcripts created questions, and I recontacted some participants for clarifications. So the data analyzes the listening guide method. The listening guide as a specific listening process, which consists of three distinct listenings, each one taking researchers deeper into their participants' inner world. So the first listening is listening for the plot, which is retelling the story and situating the narrative within its multiple contexts. It involves asking what, when, where, why, and with whom questions. I started by asking myself, what made this interview surprising? And I observed emotions, contradictions, gaps, the unexpected, noting the metaphors, and positioning myself within the research. On the transcript, I used different colors to highlight words, repetitions, topics, verbal behaviors, emotions, silences. I also included participants' demographic information answers as they pertain to their context. I also wrote my reactions, assumptions, and questions. Then the second listening is listening for the I with its associative logic, and it helps the researcher enter participants in the world. I listed all the I plus verb or I plus adverb or plus adjective and from each transcript. And then I noticed, do they use I, we, you, or they when they speak about themselves? So really listening for the I is really to understand how does the participant speak about herself. The third listening is listening for contrapuntal voices. So it's understanding the subconscious and listening to the harmonies and dissonances between the different voices. It is listening to what is said and not said within the participants' multi layered voices, in contradiction or not. This step is a long process of listening to a possible voice, describing it, explaining its relevance, keeping it, or looking for another one. I listened to the tone, rhythm, pace, and musicality of each voice. I noted the voices I heard, and then I checked the recordings, and a lot of times I changed my mind. So I finally found similarities between participants' voices and combined them when possible. So the findings. We'll start by participants' demographics based on March 11, 2020. So the age of participants ranged between 34 to 53 years old. They were living with one or two children in their solo home. Their children's age were between 5 months to 21 years old, with a medium age of 11. 5 single working mothers identified as white, one as a Latina, one as a Latina white, one as a Black, one as an Arab American. For work, they were all different types of work. So I had a teacher, a behavioral intervention specialist, a therapist, a hairdresser, a lawyer, an internal communication manager, senior sales director, a chief of staff, and a director of learning services. 78% of the participants had graduate degrees. Um, Also, 7 lived in the US and 2 in Switzerland. 4 shared custody with their exes, and 1 had limited supervised visits. 4 participants had no contacts at all with their children's father. So, mindful breathing observations. So, Seven out of nine participants gave their feedback on their experience of the mindful breathing at the beginning of the interview. So, just to remember, I offered to take 3 guided, slow, and deep breaths, um, just to increase presence and focus. 5 other participants found the experience positive as it helped them focus and relax. 2 did not, as they were surprised. For me, it helped me focus and be a better listener. So, participants' definition of resilience. They define resilience from their experiences. One preferred to use the words mental fortitude to resilience, thinking that resilience was overused. Others compared resilience to a muscle, spectrum, survival, strength, faith in the future, and growth. Their definitions morphed into a synthesized definition of a process that led to learning and growth. So, the new definition is resilience during the COVID-19 pandemic was a process that led to learning and growth and included acceptance of what is and change, entailing agency, perseverance, positivity, self awareness, self compassion, and self care. So, the findings from the listening guide. As a narrative inquirer, I intended to give voice to the experience of resilience of single working mothers during the COVID-19 pandemic. And the listening guide method gave me the tools to hear their non intentional voices. I heard the voices they wanted me to hear and the implicit ones as well. The I poems, also called voice poems, and the contrapuntal voices freed my participants' unconscious voices. So, voices of the I poems. Here, you are going to listen to examples of the I poems from Naomi, Jess, and Elena, which are 3 participants in the study. Naomi, I will say, I can't really tell. I can just tell. I believed. I couldn't see. I believed. I knew. I knew. I was gonna get out. I didn't know. I didn't see. You can make it. You are going to learn and grow. Jess, I've created. I'm doing. I'm doing. I'm going to do. I'm going to do. I'm not going to quit. I'm not going to give up. Elena, I didn't want to worry. 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 I needed to just be. So for the contrapuntal voices, here are the 6 different contrapuntal voices that were found. The voice of diffidence and guilt versus the voice of confidence. The voice of compassion and gratefulness versus the voice of frustration. The voice of not being enough versus the voice of being enough. The voice of reinvention versus the voice of sameness. The voice of suffering versus the voice of healing. And then the fighter voice versus their surrender voice. So, the definition that was found included a combination of the characteristics observed in all single working mothers. And those were self awareness, acceptance, self compassion, positivity, agency, self care, and perseverance. So, self awareness. Emma did her inner work and explained that resilience came, she said, as a consequence of all the work that I had done on myself. Acceptance. Single working mothers acknowledged that resilience meant accepting what was. Sophia explained. We took it as it came and tried to make the most of it. Self compassion. Lisa said, you can't be the perfect mom. Positivity. Naomi explained, I knew that this wasn't my forever. Agency. Jess fought her custody battle, changed her state law to include coercive abuse in the abuse definitions, and created her support system. Self care. Self care became a need fulfilled according to everyone's preferences and resources. Marta listened to The Power of Now by Eckhart Tolle. She explained, just finding the joy of being present, you know. When you're present, you don't worry about the future of it or the past. Perseverance. Jess persevered in creating a support system, in finding childcare, in fighting her custody battle case, and in changing her state law. She explained. Resilience was sticking with my commitment to keep my daughter fighting for her and other families. The voices heard. The I poems. So Naomi lived in a challenging psychological state, worrying about her homelessness, hunger, and mental state while pretending to be on a staycation for her children. Her I poems revealed her pretending or lack of confidence in her contradictions when she said, I knew, I didn't know, I can't tell, I can't just tell. I was gonna get out. Her poem showed her doubts and a lack of confidence I hadn't noticed during our interview. It revealed what was not said out loud. At the same time, I saw there her conviction that she will survive her difficult situation and would find proper housing for her family. Naomi grew during the COVID-19 pandemic and transformed, understanding that she had to fight her state laws to protect those who lived above her state's poverty salary limit, as she did. Contrapuntal voices. So Nicole, Lisa, and Sophia's voices of not being enough versus voice of being enough revealed a systemic struggle connected to the stereotyping of single mothers found in the literature, showing single mothers are as less than. Nicole, the owner of her law firm, had to prove that she was a good enough entrepreneur. Lisa always thought she was not a good enough mother until her daughters told her how much they admired her. Sophia noticed that she never had enough time for her children, her work, or her partner. She felt pulled from all directions. However, the work flexibility of the COVID-19 pandemic changed her perception of not having enough time. So, what are the implications of this research? So, the listening guide first has a whole system approach in which each listening is interdependent on the other two and contributes to the whole analysis. So, listening for the plot, the first one, revealed how participants wanted to appear in their stories and how I was affected by their telling. The second listening, listening for the I, revealed dissonances or confirmations of attitudes that added to my understanding of their experiences. And the last listening, listening for contrapuntal voices, is where I combine similar voices in different contexts. And this helped me zoom in and out of the stories. And I was able to see the larger picture supporting a feminist lens by outlining gaps in system support. I could see how our society failed to support single working mothers during the pandemic. So, the mindful breathing considerations. So, I would recommend informing participants before the interviews and allowing them to accept or refuse to participate. And this way, I would eliminate the surprise effect. I would also recommend inviting participants' feedback at the end of each interview instead of what I've done weeks later. So, and then contribution to practice. The new definition of resilience that you've heard before can be translated and applicable in professional coaching services. And the resilient and wellness wheel that you can see here could be a coaching tool to help coaches and their coachees understand where they stand on their resilience and wellness. The 7 domains of the wheel are the characteristics in the new definition, and clients could choose either to quantify or color their perception of where they stand on each domain. They could even put pictures meaningful to them. And this created awareness would help them decide which domain to work on with their coach. The limitations and recommendations. So I will start with the limitations. This research studied single working mothers, which limited its reach and understanding of single mothers. Also, it recruited 7 participants from the US and 2 from Europe, knowing that different countries applies different COVID-19 restricting measures. This recruitment limited the understanding of a population within a country. The self-reporting nature of qualitative interviews might have led to inaccurate reporting. And also the single working mothers identified as resilient, which could have influenced the positivity of their telling and limited the complexity of the concept. And finally, the timing of the research. The study recruited participants 3 years after the pandemic and the lockdown occurred, which could have affected the memory of participants' experiences of resilience. So my recommendations for research is using the listening guide method for any vulnerable population. Filling the gap in the literature on single parents using the listening guide. Also study the relationships between the 7 characteristics of the definition and learning and growth. Study the differences of grounding techniques at the beginning or during interviews. Study the resilience and wellness wheel as a resilience model in a coaching intervention. Study the importance of each characteristic in single mothers' lives. So today I presented a study conducted in 2023 about the experiences of resilience of single working mothers during the COVID-19 pandemic. So now you understand better why and how I conducted this qualitative study. You learned about narrative inquiry and the listening guide analytic method, and how these methods gave me the tools to answer my research question, which is how have single working mothers experienced resilience during the COVID-19 pandemic? The findings in this study do not negate our societal responsibility to provide better systems for these women. We have fallen short in not supporting the single working mothers in our societies during these drastic times. And we still need to take responsibility and act to make those improvements, as did two of the participants in this study who stepped up to work for social change despite their challenges. So you can find all the references used to create this presentation or for the study in the reference listed here. Also, if you want to know more about the listening guide analytic method, please listen to the workshop I conducted on the listening guide method. Thank you.